What do you need to do to prepare for your 36-week prenatal visit? Hey, moms, I'm Dr. Shaunna Mason. I'm here to talk to you all about how your body's getting ready for baby, having your baby, and recovering postpartum. As a board certified OBGYN, I answer these questions every week in my office, and it's my goal to reach so many of you to help you feel so much more informed about all the changes your body's going through, both as you get ready to have a baby, while you deliver, and of course, during that long recovery of becoming a new mom and all the changes that happen in our body postpartum. So let's talk about that 36-week prenatal visit. Now, most likely you've been seeing your provider a little more often for the last few weeks. So most doctors and midwives start to see moms a little closer together, usually every 2 to 3 weeks, starting around 30 to 32 weeks. So another, 4 to 6 weeks has gone by, and now we are so close to that estimated due date. And so we are going to start seeing you every week now. And so here are some of the things that we're going to be looking for, so that you know kind of what to expect at these visits and also what questions to ask. So one of the things that usually happens around this time, now every provider is different. So I'll talk to you about things we do and kind of the practices I've been a part of, is an ultrasound in the third trimester. Now this can happen anywhere from 32 to 36 weeks and maybe more than just one ultrasound, depending on any medical problems or concerns your doctor may have about you or the baby. But sometime in the third trimester, we do another ultrasound to check on the baby. And while it is so nice to see your baby, there is some important information we're trying to gather. One is to get an idea of how big your baby is. Sometimes babies grow a lot bigger than we expect or a lot smaller than we expect towards the end of pregnancy, and that can be something that we need to keep an eye on or start strategizing as far as delivery may go, so that we can help you and the baby still get here safely. We also want to know the baby's position. So some of you may not know, but babies cannot come out bottom first if they are singleton babies. Now, sometimes that exception can be made for twin babies, but if you have a singleton baby, especially if this is your first baby, providers do not generally deliver babies breech anymore. So if your baby isn't head down, you want to know that in advance so that your doctor can talk about some plans to help this baby get out of your body safely one way or another. We also want to make sure the fluid surrounding the baby is still normal. The fluid is the baby's cushion to prevent them from rolling over or smashing their umbilical cord that could affect blood flow between them and the placenta if that is an ongoing process. So we need enough cushion or fluid around the baby all the way to the end, until they are out of your body, to make sure that they have a healthy water environment to live in while they are still inside of us. This also gives us an idea of maybe how healthy the placenta looks. So while we don't grade the placenta as much as we used to anymore, it does sort of help us know if these are babies that are showing some signs of stress, maybe aren't as active as we thought, our fluid's not as strong as we thought, and we need to keep an eye on them maybe a little bit closer. So it is so nice to see your baby at the end of pregnancy. It's different than your 20-week ultrasound because they are taking up most of the space and it's hard to see them as a whole unit. But we try to, show you their face and give you a guess on their size and that kind of stuff. Remember, these are all estimates. Ultrasounds give us a guess of things about the baby as far as weight and size go, but not exact measurements here at the end. We also will do standard stuff. So check your blood pressure, make sure you're not dehydrated or that you're spilling protein in your urine. Unfortunately, preeclampsia is a common disease that affects many, many women at the end of their pregnancy, even moms who have no risk factors, no medical problems, and who have had a very smooth pregnancy up until the time this disease presents. And sometimes there are no warnings that it's happening, but it is one of the most important reasons to get weekly prenatal visits at the end of your pregnancy, because this disease can present very quickly and make you very sick very fast. So having routine blood pressure checks and making sure, your urine stays really clear and healthy is really valuable for you and your provider to getting you to the finish line with a healthy baby. We also want to catch up on some last minute lab testing. One of those includes the GBS swab, or group beta strep. This is a bacteria that lives naturally on 1 in 5 women, so 20%, so pretty common in the scheme of estimations, right? So if you're one of these 20% of women, we want to know to give you preventative antibiotics during labor so that your baby can exit your body safely and not get exposed to this bacteria. GBS is something we can screen for, and it is a bacteria that's been known to cause severe infections in newborn infants, and it doesn't always present immediately. So we want to have the opportunity to remove that bacteria from your body so that your baby can enter the world without exposure to that. That could cause them either blood infections or lung infections and be really dangerous for them. We also want to screen for infections that can live in mom's system that may present throughout your pregnancy, that we want to have an opportunity, again, to give you medications during labor or the end of pregnancy to help reverse or prevent that transmission to baby. This includes things like HIV and syphilis, hepatitis, and we know these things are uncommon, but the value in knowing if they're there is we have some opportunities to reduce what's called vertical or mom to baby transmission during pregnancy or especially during delivery. So we have gotten to a point where we screen lots and lots of moms for that in the third trimester. We also look for anemia. Again, our babies drain a lot of our resources, not to mention our energy, right? But iron stores are something that can get depleted as our body has worked so hard all of these months to help grow this newborn. So screening for anemia, again, in the third trimester can be really valuable because we have an opportunity to replace some of that iron, both through oral means or even injection means that can help you be more prepared, your body be more prepared for the blood loss we know will happen during your delivery. Now, that's true whether you have a vaginal delivery or a C-section. Unfortunately, blood loss is a common problem that happens during delivery. It's a normal part of having a baby, but sometimes it can be more than we were expecting. So we want to make sure that we're starting basically with as much gas in the tank as we can, that your body can tolerate some of those losses a little easier. We also would follow up on any medical problems that we know can get worse at the end of pregnancy. You may need adjustments in your thyroid medication or your, blood sugar management, right? So if your doctor's been following these things throughout your pregnancy, sort of teeing things up, making sure all of those treatments are optimized as we welcome this baby into the world is really important. So having an opportunity to follow up on any of that stuff and tweak or change or adjust things as needed is really important for your doctor. We also want to make sure that you have thought about who you want to be your pediatrician, who is planning to see this new baby when they're at the hospital. Most OBGYNs do not function as pediatricians, contrary to what you may see on Grey's Anatomy. Family doctors still do, but most OBGYNs focus only on mom care. And once that baby's on the outside, they will need their own super smart, wonderful, loving doctor to take care of them. So just understanding what that process looks like at your hospital, who your doctor recommends, who's covered by your insurance, close to you guys, making those visits convenient, I think is really important to think about before your baby's here. You also want to make sure you're registered at your hospital, that you have all your insurance information there, your account number, that you are good to walk in the door and have your baby with your doctor there. It's a good opportunity to decide and talk about your doctor's process for a circumcision if that's something that you're interested. If you're having a boy baby, all doctors have different processes, different consulting teams. Some do it, some don't, kind of understanding what that looks like. Will it be done in the hospital? And if you're interested in having it done, how do you make sure it happens while you and your baby are still there? And then, of course, talking about your birth plan. If you haven't done that already, I think this is a good opportunity to talk through some of your fears and concerns that you may have about delivery with your doctor before you are in it, right? That really is the whole purpose of having a beautifully built birth plan, is to not only talk about what your goals are and your hopes are and kind of this vision that you have for you and this baby making your entrance into the world, but also to talk about the things that scare you, the things you really don't want to happen, and why they might happen, so that you can have some time to think about it and process it before you're in the moment, right? That's why I have built a free birth plan template and companion guide to walk you through this process, to talk about all the things that I think moms should include on their birth plan so that you can build one that really works for you. We are all on your team, right? Doctors want you to have the birth that you want, but we also, need to keep you and this baby safe. We have a unique challenge in our field that we always have two patients to be worried about. And so we want to work through what those fears are before we're all living them, so that we can help streamline that process and keep you and this baby safe all the way to the finish line. So again, this is what to expect at your 36-week prenatal visit. Hopefully you're seeing your doctor every week, and these videos can help you prepare for those visits and get your questions answered so that you can birth with confidence. Make sure you subscribe to my channel and share it with all your friends. Please, I'd love to hear what you want to learn more about, so drop some comments below, and I look forward to seeing you next week.